Hello friends, my name is Vanshika Tyagi and this is my channel The Living Science. Here you find the knowledge of some interesting facts of life as usual, and today's question of mine here is, what is the cause of females' infertility basically? Today I will tell you about one by one. First of all, the first term of art is anovulation. As the word itself indicating, what is this anovulation? Anovulation is the condition when there is no release of ovum from the ovaries of the lady is anovulation. Now, when does it occurs basically? This basically occurs when the lady is under the lactational amenorrhea. Now, what is this lactational amenorrhea? It is actually nothing but a condition through which the lady goes just after the birth of the baby. Right? What is here happening? For the next 6 months, as soon as the lady has giving up the birth of their babies, what is happening here? There is no release of ovum. So this anovulation is also a kind of rhythmic method of contraception, or I could say a natural method of contraception, because as soon as there is no ovum, the sperm will also be unable to fertilize the egg. Getting up the point? And if there is no ovum, then sperm is useless. So there is the kind of infertility. But remember, this is only the secondary infertility, means this is not permanent. Second is oligo-ovulation, means when there is deficient ovulation. What is happening in the normal cases? The lady is being ovulating each month, one ovum at each month. But in those cases, the lady will ovulate one ovum in 2 months, then she will not ovulate for next 2 months, then she will ovulate within the month. Means this is the irregularity. So deficient ovulation will be there. This may occur due to high stress level. This may occur due to different feeding habits. Now third one is indifferentiated corpus luteum. Now what is this corpus luteum? Corpus luteum is actually the condition or the product, I could say, which is being left over just after the release of ovum. Alright, this is corpus luteum. And this corpus luteum or the CL is the source of progesterone, the big source of progesterone. And as we guys are very well aware, the progesterone is also known as the pregnancy hormone because it regulates the pregnancy throughout the gestation by making the endometrium, the inner layer of the uterus, strong to hold up the pregnancy for 9 months, for next 9 months. Right? So if there is indifferentiated or undeveloped corpus luteum, progesterone level will be less. So ultimately the inner layer of the uterus, endometrium, will not be able to hold up the pregnancy throughout gestation. So miscarriage will occur. Again and again miscarriage will lead to the infertility. Right? So this is also the cause. Second one is fallopian tubes fails to pick up the ovum. As we are very well aware, there are specific mechanisms to pick up the ovum as soon as the ovaries will release it. Right? We are aware about. So fallopian tubes, somehow, if they are not able to pick up the ovum, because we are aware where is the site of fertilization. This is at the isothalamic junction of fallopian tubes. Now suppose if fallopian tubes are not picking up the ovum, then fertilization will not be possible, because to be fertilized, an egg should be reached at isothalamic junction first. And if fallopian tubes are not picking it up, we will not be able to fertilize the egg even after more and more efforts. Getting up the point? And this may occur due to unfunctional cilias as well. This when fallopian tubes are fails to pick up the ovum. So fifth point is defective endometrium. As we guys are aware, the endometrium is playing the huge role to hold up the pregnancy. But what is happening here? Your endometrium is defective, means this is not functioning well. So the grip of your baby to your fetus, or I could say to your fetus, to your baby, the grip of your endometrium is not so hard, is not so tough. So if grip is not so tough, even a single or little jerk may wash up your pregnancy. So this is also the reason, defective endometrium. Now, fibroid uterus means when you may have the history of fibroids. Means now suppose if you are suffering from some kind of fibroids, like This may be uterine fibroid, or there are some also disorders, some cancerous fibroids, and there are huge disorders regarding this fibroid. This may be cancerous or non-cancerous, this fibroid. This is actually a kind of tumor in the uterus. This may be cancerous or non-cancerous. Means if the patient is having the history of this fibroid, then also she may suffer the problem in the conceiving process. Right? So this fibroid. But this is also a kind of secondary infertility. Right? Now the seventh and most important one. Defective vaginal growth. When the vagina of the lady is not well developed. This is defective. The defectant may be the hymen breakage, defectant may be somewhere else. But when there is the defect regarding your vagina will not be able to pick up the semen, will not be able to pick up the huge volume of the sperm is coming inside. Right? So what will be happening then? Then also the lady will suffer from infertility, means she would not be able to conceive. So they are the huge reasons behind the infertility of the lady. So this was the answer of mine for today. If you people like my videos, please don't forget to like, subscribe and share. Thank you. Have a great day. And don't forget to send feedback on my email address as usual, vanshikatyagi98@gmail.com.